This patient was referred to me for endodontic treatment of two teeth. Tooth number 5, as you can see, tooth is part of is an abutment to a 8-unit bridge. Okay, so that's tooth number 5. And tooth number 7 that we needed to redo the root canal. This patient is a trucker, so he really didn't have much time, so we decided to do both of these treatments, endo treatments, in one appointment. So number 5 endodontic treatment and number 7 endodontic retreatment. I'll show you number 7 in a second. But do I need a CBCT for this tooth? It looks like you can see the canal and then it disappears. That's usually a sign of the tooth having two canals or two roots. So take a look. Just another PA, one more PA, and there you go. And now you can see two roots. That's one, and that's the other one. So I don't need a CBCT. It just I can figure this out with two PAs, and that goes with 99.9% of the teeth. You just angle the tip of your X-ray gun, angle it straight on, mesial towards the distal, and then distal towards the mesial, and you can open these teeth up. So that's tooth number 5. And there was also a sinus tract associated with the tooth right there, as you can see. That's tooth number 5 right there. 6 is a pontic, and then 7 I'll show you in a second, and that's an 8-unit bridge. So the sinus tract right there. And this is tooth number 7. According to the patient, this root canal was done a few years ago, and you can see a large periapical lucency right there. And as I said, this bridge, according to the patient, is a couple of years old, and the bridge was cemented with temporary cement. So patient requested that I remove the bridge to do root canal on tooth number 5 and redo the root canal on tooth number 7. And I told the patient I do no such thing. I don't want to be responsible. If I try to remove the bridge, this long bridge, and I break it, I don't want to be responsible for it. Break the bridge or break the teeth underneath the bridge, the abutment teeth. I said, I'm not going to do such thing. You're welcome to go back to your dentist, have your dentist remove the bridge, and come back and see me, and then I'll do what I need to do. Then you go back to your dentist, and your dentist can re-cement the bridge permanently. So patient said, fine, okay, I'll do that. Patient came back and I was thinking, well, the bridge is off. No, patient said that his dentist, who had cemented the bridge with temporary cement, couldn't remove the bridge. The dentist couldn't remove the bridge, and said, that's fine, just the endodontist would have to go through it. So see what I mean? I know my limitations. I know what's best for the patient and what's best for me, and what's best for the dentist. So if I had tried, I would have probably come to the same conclusion. Probably patient would have suffered, and as I said, I might have cracked the bridge or the abutment teeth. So the dentist tried. The dentist himself, who had cemented the bridge with temporary cement, had tried to remove the bridge, couldn't do it. So what we did was we unfortunately had to go through this pretty brand new bridge to do root canal on tooth number 5 and redo the root canal on tooth number 7. And that's what we did. Take a look. So this is tooth number 5. We just went, as I said, through this porcelain bridge. And as expected, as I showed you in the pre-op PA, 2 canal systems. So you can see these were almost 25 millimeter long roots. This is another angulation. You can see tooth number 5, 25 millimeter long roots. And this is tooth number 7. Again, went through that 8-unit bridge, removed the old gutta percha, and cleaned it out, irrigated with full strength 6% sodium hypochlorite copiously. The apical diameter was over 50, so placed an MTA plug followed by gutta-percha and sealer and temporized both teeth and referred the patient back to his dentist for the permanent restoration. So we talked about why I like to use MTA in these cases where the apical diameter is 50 or more. MTA will give you in these situations where the apical diameter is 50 or more, the MTA will give you a better apical seal compared to gutta-percha. And also, just in case if later on we need to do an apical on this tooth number 7, then apical will be much easier because we will not be needing to fill the tooth, obturate the tooth from this way. It's called retrograde. We don't have to do it because we already have MTA there. So all we need to do is resect a few millimeters of the end of the root and we're done. Of course, clean all of this out and the rest of the apical procedure that we have to do, but retrograde obturation we don't have to do because we already have MTA here. So you always think ahead. And excellent. And this is another angulation. You can see tooth number 5 with 2 canals and tooth number 7 MTA plug. We use white MTA plug, gutta-percha and sealer.